Hello class, as promised, I'm going to give you a few more explanatory comments related to pulmonary tuberculosis. As we talked about in class, it's highly communicable, and it's because of the small particle size and the ability for the Mycobacterium tuberculosis germ to be in the air and kind of in an aerosol fashion and on droplets of coughed material be sent through the air and therefore transmitted in that method to an unsuspecting host that might pick it up when they breathe in. Patients can have secondary TB because of developing it because they're hypersensitive to it, because their immune system is just so low that it really doesn't take much for them to pick it up. And you see that a lot of times with patients with HIV infections. And then, as we talked about in class, there are other risk factors. Homeless patients that may be around patients that have had the disease more frequently, or people who are housed in confined areas such as group homes or facilities, or in jails where they're really having much more prolonged exposure to these high-risk groups, are more likely to contract the disease. So once you're exposed, you may go for several years until you may not have symptoms for a long period of time. And just like we talked about with lung cancer, sometimes people will have some respiratory issues off and on, but they don't always fully manifest and become really noticeable. And with tuberculosis, you have the Mycobacterium germ, and it grows in an area of your lung until it creates a true-on infection. So some people may have been exposed to TB and might show positive on a PPD test, but when you do a chest x-ray of them, there's no visible tubercle that has latched on or has yet begun to grow in the lung. So some of the later manifestations with the true blown infection are going to show up as these type things that we've already discussed. And again, the two most kind of more in the tuberculin line than other things that are respiratory would be ongoing night sweats, and then this really, really purulent sputum that has blood streaks in it. So, of course, to do an assessment for this, you're going to really want to look at a typical history and look at all those social and socioeconomic factors. Have they been around anybody else that would have potentially put them at high risk? And if not in those types of environments, then even within the home setting, whether someone else may have been exposed at some point. A full physical assessment is necessary just to look at many of those factors. Look at lung capability. Are they, what do they sound like on auscultation? And then all the clinical manifestations, as I mentioned before. Typically the places where people show up the most frequent who need these type of assessments are going to be in ambulatory care centers where they're seeking care, or they're coming into the emergency room. So the electronic medical record in most every ED has these as preset screened items for all those clinical manifestations that we just mentioned on the previous slide. If somebody has a positive on one of those, the patient is usually then asked to wear a mask as long as it's not creating a respiratory problem for them, because those are things that might be communicable for all types of pneumonias and different things anyway, and as well as flu, which we already talked about. However, the most appropriate function if you have suspicions of potential TB, or you'll see somebody listed as rule out TB, those patients need to be put as fast as possible into a negative air pressure room in airborne isolation until the full assessment of labs and different things can be completed. The reason is Occupational Safety and Health Administration, which is a federal government branch, OSHA in other words, has specific rules for safeguarding healthcare workers from being exposed to tuberculosis. And so you should never be put in a situation, if there's when in doubt, isolate, and isolate soon. Don't wait. And you'll see when we look at some of the other things that we're going to assess for in terms of labs and things, some of these things take just a little while to come up with an answer related to it. Should you have to care for one of these patients, at that time you should have a N95 mask or a PAPR unit. One of the two would be what you have to use when you go into that room. A regular mask will not work, and we'll look at those pictures again related to those masks. As a new employee, when you come to work at a hospital, if you're going to be caring for these type of patients, you are going to have a PPD tuberculin test to see if you've ever been exposed. And that's usually done on an annual basis, just to kind of screen for making sure employees are not having exposures through their employment. Part of that too is if for some reason an employee, for whatever reason, has a false positive when they take PPDs, they will pretty much not allow them to take any more of those because it might create an allergic reaction, for example. And then they would have to go through kind of an annual renewal type situation and for being able to work there, part of which might include having chest x-rays annually, depending on the facility's rules and policies, or in lieu of that, they may have to undergo an assessment that looks for these same clinical manifestations that you're looking for in the patient. The employee would be asked if they've had any signs or symptoms of the disease. And fit testing is always reevaluated annually also, along with that, because they'll ask you questions like, have you gained weight, have you grown a beard, have you done anything, had any major dental work, anything that might change the shape or the texture of your fit of the type of mask that you had already been pre-approved in terms of the right size to wear. And if any of those things have changed, then you have to go through fit testing again to verify that what size you need following that. So just a few tips on fit testing and why all that's done. In terms of the patient, your diagnostic assessment, of course, looks at this, clinical manifestations. There is also a nucleic acid test that they amplification test that they do that looks for, I believe it's DNA and RNA strands, and at the molecular level, and so that kind of sputum test can get you results like within a couple hours. It is not always exactly the same as getting a sputum culture for either acid fast bacillus or for Mycobacterium tuberculosis itself, both of which of those take a couple, usually 48 hours. Like we talked about before with getting sputum cultures, it takes a while for those to grow out. So this initial test can give you some idea, although sometimes there are some false positives. But again, it's better to keep somebody isolated while you're going through this diagnostic assessment to safeguard all the workers, not just the nurses, but even the people taking in, linen, or someone coming to mop the floor. Everybody needs to be aware and safeguarded when they're going in a potential room like this. As I mentioned before, the tuberculin test, which is called the Mantoux test, or you may hear people talk about it as a PPD, is given intradermally in the forearm, and we'll see a picture of that. And so the measurements will be usually in terms of how large, in terms of the width of the reaction and the diameter, is considered positive for exposure if they have a 10 millimeter or greater diameter, and they have induration, meaning that it is reddened and hard, not just pink, but it needs to be reddened and hard, and that much diameter. For HIV patients who have limited immune status to have this reaction to it, they count an induration of 5 millimeters or greater, just because they're less likely to have a response because of their immune system. And here's a picture of how they do this. A skin test is placed. You may be doing some of those in the near future. And you must wait and have it rechecked within 48 to 72 hours. If it is not rechecked by a nurse to measure it and view it within the 72 hour, or between 48 and 72 hours, then it has to be completely repeated again. So very key teaching point with patients to make sure, and with healthcare workers who have to get this test quite often, timing is everything. 48 to 72 hours is essential, or it has to be redone. And nobody wants to have to come back and get it redone. So interventions, the drug therapy for tuberculosis is very strict. Many of the drugs the patients will be required to take for 6 months or longer. Isoniazid has some side effects that affect the liver, so you have to get other additional blood work tested. Rifampin will turn your urine a discolored color. So those are just a few key facts about those. And patients often, because of some of the side effects of them, and just remembering to take them, and you think about the patient population sometimes who would need to be on them, may not have the money, or may not have the transportation to pick them up, and different issues. So these are monitored very, very closely and have to be reported to the health department when there is a case of tuberculosis, so that there is external follow-up to ensure that there is adherence to the medication for treatment. If they have a negative sputum culture, then they are considered no longer infectious. And again, when we talked about airborne isolation, they have to have a negative air pressure room, meaning that the way the circulation of the air is pulling air into the room and going out through external vents, so that no air and no droplets from inside the patient room, when the door is open for someone to come in or out, there is no escape of that air into the hallway or surrounding rooms. And there is a way that that's set up. If you go on a unit and you see that they have a negative air pressure room for isolation, you may want to just see, how you turn it on. It's a little measurement, and it's set to be at a certain negative pressure and a little gauge on the wall. And many times those rooms, they're set up for isolation, and they might be used for some other isolation, but the negative pressure air vents are not turned on unless it's a condition that requires it, such as this. So home care is like a big deal because you're having to make sure that they're on medications for a period of time until they're not deemed contagious to the rest of the public.